So the core caregiving is the same, whether it's a man or a woman, but there are differences between us biologically, physiologically, as well as socially, and possibly even culturally. So here are 5 more differences. When you're looking for a caregiver, you might want to honestly have those open conversations with the person needing care to see if they want the same sex gender, because that's what they require. Let's get right into it. Activity interests. Women may enjoy crafts, cooking, or music. Men may prefer tools, games, or current events. So here's a solution. Customize activities to reflect lifelong interests without reinforcing stereotypes. Now, this one is a little touchy because I know a lot of women who like to do DIY, and I like, to do some house projects that I could handle myself. And then I know a lot of men who like to cook. The whole purpose is to make sure you have that conversation as far as what they prefer. Clothing preferences. Women may want more attention to wardrobe choices, whereas men may prioritize comfort and simplicity. So respect the grooming and clothing preferences as part of their dignity and identity support. Grooming and hygiene. Women may desire things like hairstyling. They want their nails done or skincare. Men just want basic routines. Let's be real. Most of them, when they older, they too tired to go out. That's just my experience. I don't know of any man, once they get barbered and they got their beard cleaned up and they older at a certain age, you ain't got to go through all that, right? Let's just make it simplistic. So here's a solution. Include optional grooming and care plans and normalize those services so that they get it on a regular basis. Nutritional needs. There's a difference. Older women may want more calcium and iron in their diets, especially if the doctor has stated that, whereas men may need more cardiac friendly diets. So here's a solution. Collaborate with the healthcare providers to personalize diets for gender specific health needs. And your doctor's the best person to tell you what they need. So make sure you have that open communication with them. Pain expression. Here's a difference. As a woman, I'm going to be honest with you. I will tell you if I'm hurting, and I'm going to tell you frequently that I'm hurting. I don't want to be a nagging person. I'm not a nagging person, but if I'm in pain, I'm going to express it, okay? Whereas men may suppress or underreport it. Here's a solution. You as a caregiver or person who loves the person that needs care, monitor behavioral cues for discomfort and document changes thoroughly, especially in clients that are kind of stoic. They really don't want to talk about what they're feeling or what they're going through. Is any of this helping you to help make decisions and having open communications with other family members or the person that actually needs care? I hope so. If you need more caregiver support and more documentation or content that's going to help you make decisions about whether it's hiring a caregiver, whether or not it's the personality of the caregiver, and now even what the gender should be for the person who needs care, visit our website, HansonCaregivingConsultingServices.com. We're trying to make it easier for you. We're trying to give the caregiver community some support. Until next time, because I got more. There's always more content. And I got some more on this actual topic that I'll share with you and drop later. But until next time, this is your girl, Essie. I'm out.